Now, the most famous among the three keyholes is the McCarty keyhole, which was described by this particular gentleman, Colin McCarty, and he described this burr hole in this particular book, The Surgical Treatment of Intracranial Meningiomas. So, keyholes has almost become synonymous with the McCarty keyhole. Now, according to the first description by McCarty in his book, the McCarty burr hole was supposed to be somewhere over here. If you can look at this, this is the zygomatic bone, this is the frontal bone, and this is the frontozygomatic suture. Now, if we trace the frontozygomatic suture until this particular junction, we reach this suture. It's called the frontosphenoid suture because this is our sphenoid bone over here. This is the frontal bone. This is the frontosphenoid suture. So, McCarty said that the McCarty burr hole is supposed to be placed nearly 1 centimeter from the junction of the frontozygomatic to the frontosphenoid suture. So, somewhere from here, this is the junction, around 1 centimeter would be here somewhere. So, this was where the burr hole was supposed to be placed. So, the McCarty's burr hole was supposed to be nearly twice the size of the average burr hole, and it was this location that was important, 1 centimeter from the junction of the frontozygomatic to the frontosphenoid suture. So, if we actually look at the corresponding point from inside, it would be somewhere in between. So, if we will be putting our burr hole over here, a large burr hole, half of this burr hole would correspond to the orbit and half of it would go intracranially. So, that is why the McCarty's keyhole shows two parts. One is the orbital part, the anterior cranial fossa, and between them will be this, the roof of the orbit. So, this is how McCarty described his burr hole. So, this is how our McCarty burr hole would look. This is the orbit over here. This is our frontal bone, the zygomatic bone and frontozygomatic suture, nearly 1 centimeter above it. So, when we place this particular burr hole, we can see the periorbita in the lower half of the burr hole, the frontal dura in the upper half, and in between is the roof of the orbit. And now this particular burr hole is important when we do frontoorbital approaches because we need to cut through the roof of the orbit and we can access that through this part of the burr hole, and this part accesses the anterior cranial fossa. So, this is the most important of the keyholes, that is the McCarty keyhole. The exact location of this particular burr hole was also studied by Shane Tubbs et al. And they published this in Neurosurgery in 2010 in this particular paper, Refined and Simplified Surgical Landmarks for McCarty Keyhole and Orbitozygomatic Craniotomy. And they said that this particular keyhole center was 6.8 mm superior and 4.5 mm posterior to the frontozygomatic suture. That's nearly 7 mm superior and 5 mm posterior. This is how they standardized the location of the McCarty keyhole. So, after McCarty's keyhole, the next keyhole that we will be talking about is the very first keyhole that was defined, and this was defined by none other than Dandy, and it was used in his stereonal approaches. This particular burr hole lies nearly 5 to 10 mm above the McCarty burr hole, somewhere over here, and this is used in stereonal approaches when we want to approach only the anterior cranial fossa. So, this is the other keyhole. Finally, speaking about the spinoterional point. Now, if this is the frontozygomatic suture, if we go nearly 20 mm posterior to it and around 5 mm superior, we will reach this particular point over here. This is called the spinoterional point, and if we look at what it corresponds to, it would correspond to the junction of this, the lesser wing of the sphenoid bone over here, to the calvaria. So, it basically marks the demarcation between the anterior cranial fossa and middle cranial fossa. So, if we place a burr hole at this particular point, we will be able to access both the anterior cranial fossa as well as the middle cranial fossa. Corresponds to somewhere over here, and this is nearly 20 mm posterior and 5 mm superior to the frontozygomatic suture. And this burr hole can be placed in those tumors which require an approach to both the anterior cranial fossa and the middle cranial fossa. If there's a tumor extending to both of these, we can access that through this particular point. So, this is the third keyhole. Now, the spinoterional point has been described in this paper very well. It's by Rees et al. And it was published in 2017 in World Neurosurgery. According to their paper, they say this particular point lies on an average 21.72 mm posterior and 4.76 mm superior from the frontozygomatic suture. And as expected, by placing a burr hole in this particular location, which is nearly 20 mm posterior, 5 mm superior from the frontozygomatic suture, we can access both the anterior and middle cranial fossa.